Hello.
Hello?
Yeah, good evening, Cha.
Yes, hello, Dr. Tarek. I think your audio is soft again. Can you speak
All right.
louder?
Yeah. Sorry. Hello.
Hi.
It's okay now?
Yes.
All right. Great. Okay. So, whenever it's time to start, it's up to you.
Okay.
I'm on standby.
Good evening, everyone, and thank you for joining tonight's webinar. Please be reminded that all microphones are muted throughout the meeting. And for comments, please use the chat box, and for queries, the questions box. We have two speakers for tonight. So our first speaker is Dr. Tariq Azim, Senior Technical Advisor at JSI for Measure Evaluation with over 30 years of experience working in public health and health information systems. He is based in the USA and has worked in Bangladesh, Pakistan, Afghanistan, and Ethiopia. Our next speaker is Dr. Binyam Tilahun. He is an assistant professor at University of Gondar in Ethiopia. He is a young, motivated health informatician with interests and expertise in mHealth, implementation science, electronic medical record systems, health information systems, semantic web, and big health data. One of his current works is developing a bachelor and master's degree curriculum for health information technicians in Ethiopia. So maybe call on our first speaker, Dr. Tariq.
Hello, good morning and good evening to everyone attending this webinar. Thank you for joining. Today we are going to present a guidance document that was developed by Measure Evaluation under the USAID project for improving or for ensuring that there is sharing of the community health data for better accountability in both ways, both for health system and for the community. And as Cha has mentioned, me and my colleague Binyam Tilahun, we will be presenting this work that was developed under Measure Evaluation. So why this system or this guidance document? What was the rationale that we had to develop this this work? And the reason is that, you know, we have been talking about information use within the health system for quite some time, and there have been a lot of interventions and efforts done to help improve the use of information or health information within the health system. But the health system itself is for the community, and sometimes or most of the times, the community is not in the spotlight. And you know, the information that is generated by the health system is confined within the health system itself. It's not shared with the community, because community is not seen as somebody who is the decision maker, or they will be using the data for improving their own health or for any other purpose. And the result of that is that the community feels as if it is a recipient rather than active partner in the improvement of the health. And it's their own health that they are concerned about, and they are not always knowing what's happening around them, like how many people are suffering from any epidemic or any disease. What should be they aware of in terms of you know, deliveries taking place, and women dying of pregnancies, etc. So those are the things that the community also needs to know, so that they can have a more proactive engagement with the health system and improving their own health. The other area is that there is very less accountability in terms of, I mean, within the health system, yes, you can say that there is accountability, but accountability to the community of the health system, as well as accountability of the community to the health system, that link or that bridge is not that strong. The reason that I'm talking about accountability of the community to the health system is that community is also responsible to like inform the health system about what's happening, whether they are satisfied with the services or not, what are their needs, and what the community itself can do in terms of improving their own health or the overall health of the population. So those are some of the issues, and also, if you like, the engagement of the community. I mean, there are efforts going on. I'm not saying that this is totally a new idea, and I will show you later on that in many places that's happening. But what is happening is that even if there are efforts to engage the community, it's mostly externally driven. There is a health system person or a facilitator from some external facilities. They're coming to the community and trying to educate the community, get them motivated, advocate for this engagement, and leading it. So the community is lacking the leadership or the ownership of such type of interventions to improve the community's own health by the community itself. But ownership means what? Ownership means taking responsibility. And when somebody takes responsibility, with it comes accountability. So one also becomes accountable when somebody takes responsibility. And the accountability means that committing to the decisions and the actions for some purpose, and holding oneself answerable for the actions as well as their consequences. So when we say that the community should be accountable to health system or to themselves, and the health system should be accountable to the community and within themselves as well, it means that both of them commit to some actions, commit to some decisions, and also hold themselves answerable for the consequences of those decisions or actions. So in this context, we are talking about shared accountability among the community and between the community and the health system. And when we say shared accountability, it means that it's a process by which the partners are holding one another responsible for those commitments. And it's a voluntary process. It's not that somebody is forcing them. It's more voluntary, and but there is commitment, and there is commitment to actions, commitment to sharing information, commitment to mobilizing resources, for example, and so forth. So when we say accountability for ensuring health, it's not just what we are. When I say like health system, it's not only the public health system or the government-run health system. It's also the private. In private, you have for-profit and non-for-profit organizations providing health services to the community, and so it relates to everyone under the broader definition of health system. And so when we say this shared accountability, it would mean sharing health and health-related information, taking actions, and publicly reporting and answering questions about those decisions and or actions. So that's where accountability stands. It's more like open discussion about who is doing what and being answerable and reporting. Again, as I said, it's not something that you are binding someone through some mechanism. It's more voluntary. So that's where we are promoting, in this guidance document or in this system, what we are doing is promoting that shared accountability, which is where there is sharing of information, action taking, and public reporting and answering to questions. So the purpose of this shared accountability for health at the community level is to create an enabling socio-political environment of mutual trust and transparency between the community and the health system. And this is very important, the mutual trust. It's not a kind of an answerable of, kind of a questioning in terms of why have you not done this or what are you doing, forcing them. Rather, it's a trust and self-reporting, whereby I take the responsibility and I report that I have been able to do this or I have not been able to do this because of these reasons. So this is more of a mutual trust and transparency. And it's more of collective responsibility. It's not finger pointing to someone that, this is your work, you do it. Rather, it's more of a collective responsibility and commitment so that everybody has a share of what they want to do or they can do, and also share the benefits out of that work, which is the contributing to the overall health of the community. So what are the basic principles of this shared accountability for use of community health data? One of the basic principles which we are emphasizing, and if you like, is different from other approaches, is that the community takes the leadership role in running the meeting or the forum. It's not external facilitator driven, it's driven from within the community. And so you use the existing forum that already exists within the community, which means, we don't have to create a new forum for just this purpose. There are many such forums where community and the system, especially the health system, comes and meet together, and you can piggyback on that one. But if there isn't any, you can create another one. So it's more about utilizing the existing opportunities in bringing the community and the health system together. And there has to be sharing of information. I mean, this is very important. Without information sharing, this forum would not last very long. It's more about sharing information so that there is information that the health system shares with the community, and the community brings in necessary information that can be useful for the health system for making some decisions. Such information could be information about the health status, service coverage, disease occurrences, service availability, maternal or infant deaths, and so forth. Whatever the community and the health system decides based on their priorities. And there should be this forum is basically for mutual discussion and decision making on health priorities, and then voluntarily commit to take responsibility for addressing. So the health system and the community itself, they take their share of the responsibility, and thereby they are accountable to that. And so they promote transparency, open sharing of data, but obviously you have to be careful about privacy and security of the data as well, because those are sometimes very sensitive data as well, which are discussed are necessary to be discussed in such forums. Now, once this forum is established, it's also important that that they can monitor the performance of this forum, how this forum is functioning. And for that, we have two tools. One is more qualitative monitoring, and the other one is quantitative monitoring. Both done by the community and the health system together. So there is no external monitor coming and saying, there can be, I mean, they can come and use it. But these tools are basically for the forum members to use it so that they can check where they are in terms of the success of this forum. And so if you look, there is this 2x2 table or box where you have the community sharing information and the health system sharing information, and the community taking action and the health system taking actions. And if you see that if there is only sharing of information from community and the health system, this is not, I mean, this is good, okay, but not a good situation. Similarly, if there is no action taken by either the health system or the community, that's again not a desirable situation or very unfavorable situation. What we would are promoting here is that community shares information and the health system takes the action, as well as the health system shares information and the community takes actions. So those are the green boxes, box number 2 and box 3. These are the most desired performance, and that's what needs to be promoted. And they can simply look, the forum or the community and the health system forum can have a check, periodic check of their performance by just discussing, did we share the information? Did we take action based on those things? Simple. And if they are doing that, whatever, whatever be the extent of it, that would show that this forum is working well. But then there is this more objective quantitative monitoring of the forum performance, and there are many criteria given for this assessment. I'm not going to discuss the whole of it. I'm just showing a sample of it, where you can look at the leadership, the participation, information sharing, and taking action by the community, and same the participation, information sharing, and taking action by the health system. And again, I want to emphasize by health system, we mean both the government and non-government providers within the health system. And so the emphasis again is over here is on community taking the leadership, not external facilitators taking the lead in organizing and running the meeting. And so these are some of the criteria, some of the assessment criteria by which you can grade the forum functioning. And like for community, you can have some grade of the maximum score of 10, and same for the health system, you can have a maximum score of 10. And so if there is 20, that's the highest, but we are not saying that that's something that can be achieved very quickly, but even somewhere in the middle or a higher level achievement or higher level score would be the desirable situation. And this can be done, such assessment can be done on more like yearly basis or 6 monthly basis if they are very interested to do so. And as I said earlier, that this idea is not totally new, and we have seen cases where community and health system have worked together and shared information and taken responsibility and have really made big changes. We see this in Liberia in an Ebola crisis, where initially there was a widespread non-compliance with the government-imposed cremation to prevent the viral spread. That was done to, like cremation of the dead patients, Ebola patients, was done to prevent the viral spread, but that was not in conformity with the traditions. And so what happened is that traditional and religious leaders, they came forward and influenced the development of a guideline endorsed by WHO on safe burial with dignity. And that became the policy of the government by the end of 2014, like within a year or two. And so this had a great influence in the prevention of viral spread. At the same time, involvement of the community and their preservation of their dignity. Similarly, if we look at Ghana or Malawi, they established a community-based maternal death surveillance system. The health system came up with some method, like 6 questions, to help the community do a assessment or understanding of the mortality within the reproductive age, and so they could, on one side, the community shared the information with the health system. On the other side, the health system helped them technically to come up with the system of maternal death assessment questionnaire or maternal death review, and use that data to come up with interventions of preventing maternal deaths in the community. We also see in many places, I think Mozambique is just one example, but in many places there are these dot supervisors or dot supporters. And in Mozambique, the community said, well, we would like to have some volunteers, and volunteers came out like they were religious leaders who said that they are going to take the responsibility of supervising the TB DOTS patients. And they did so. And what happened is that the patient can then choose from these TB DOTS supporters, if you like. And so they were more comfortable with them, and they could go to them and take their medicines and talk to them, and if they have some problem, they can share with them, and they would then, these supporters would then communicate with the health system. So here again, the community is taking responsibility. So these 3 examples or cases is just to show that how community and health system can come together, with community taking or the community to be in charge of what they want to do, and helping the health system in improving in their efforts to improve the health of the community. So in this stage of our presentation, I will now invite Dr. Biniam, who will give you or elaborate for you what happened in the pilot that we did in Ethiopia based on this guidance document. So Dr. Biniam?
I think it's not yet on, Dr. Tariq.
Sorry?
I think he's not yet on the call.
Okay, he's not on?
Yes, he's not yet here.
But he said, he emailed me that he's there.
Oh, maybe he got disconnected.
All right, okay. Let me just, otherwise I will continue. But let me just wait for a minute to, if he is muted or I don't know, wants to connect. Because Dr. Biniam is in Ethiopia, and we were having problem connecting him yesterday or even before. So I'm not sure if he is able to join today. But anyway, all right, let me continue with the presentation. And so, as I said, that this was done, we did a pilot, a kind of a, not a full-blown pilot of, long-term interventions, but we want to just see that whether it's possible to do such thing and what would be the reaction of the community and their leaders in organizing and running such forums where community takes leadership and brings in the whole system. So University of Gondar, which is in Ethiopia, and Dr. Biniam is one of the associate or assistant professor in that university. we worked together to carry out a test run of this guidance document, and as well as I said, learn more from it. This was done in one of the rural Kibele. They call it, this is the Kibele, which is the smallest administrative unit in Ethiopia and comprises of 2 or 3 villages. So this was done in one of the places, and as you can see in the map here, it's in Amhara region, and not in the center. It's like far away near the border of another state or another province within Ethiopia. And this Kebele has a council. So there is a Kebele council. And the head of the council is the Kebele administrator. And every Kebele has like 2 community health workers who work within a basic health center. They call it health post, and they provide basic health services to the community in that Kebele. So the first step in this test run, or kind of if we say that, even though I'm saying it is a test run, but anywhere if this has to be implemented, we have to reach out to the community at first. So even though we are talking about the leadership of the community, the first thing would be to communicate to the community and then ask them or promote them to take the leadership. So as such, the first step was to communicate and orient the community leader. And in this case, it was the Kebele administrator, as you can see in this picture, with the robe, a white robe on him. And for this communication, it was initially done through phone to kind of start the dialogue, and then there was a meeting, direct physical meeting, going there, talking to the Kebele administrator and making him understand what this forum is all about and whether he's interested or not. And so he expressed his interest and was ready for the run. And so we had, there was this preparatory step. Again, that's necessary. It shouldn't be a forum where people just come in and talk extempo, but rather there needs some preparation so that the health system can come and present certain things. At the same time, the community can come and present whatever like information or anything or their concerns. And so the community, this Kebele administrator arranged a meeting with the health extension workers, those who work in the health post, the Health Development Army. This is again another intervention of the government. And so there is a leader and child health experts from the local health center to prepare for the meeting. So he was the one who invited all of these people and asked them to sit together and prepare. So the facilitators from the University of Gondar, they assisted them in preparing the agenda, the presentations, and so forth. And they did not use like high-tech thing. It was like just simple flip charts where they put some of the data that they wanted to present. And the HDA leader, that's the Health Development Army leader, was made responsible to inform all the members of the Health Development Army to participate in the meeting. So that's how the word or the invitation for the meeting was spread. And the Kebele administrator on his own also invited 2 religious leaders and respected elderly persons and youth leaders from the community. And the third step is the actual meeting, and you can see that it's not taking place in a very fancy hotel or somewhere. It's just in front of the health post. on the field, and the members have come and gathered here, and you can see and on the left hand side that the community members are coming and chatting, and someone or a group of women, they also volunteered to prepare for coffee ceremony. I mean, that's very traditional for Ethiopia again. And so there was coffee served to all the members who were coming, all the community members who were coming to that meeting. And as you can see over here as well, the community, during that meeting, they used the flip charts and presented, and there was question answers, there were concerns raised by the community members, and then also the concerns that the health system has about communities' behavior regarding, or health behavior rather, I would say. And so there was very open discussion, and the Kabila administrator, who was the community leader, he moderated the whole meeting. So there was no one from University of Gondar in this meeting. I mean, they were there observing, but they were not participating or facilitating this whole meeting. The whole meeting was facilitated by the Kabila administrator, and the health extension worker and the community members and the HDA leader all were active in presenting and discussing their issues. So obviously what we find that yes, the community can take the leadership role. They have leaders within them, and it's not difficult to kind of orient them, and they can jump into the the role of taking or providing the leadership to such forum. And this forum again was not something which we just tried to gather them together, but it was part of the existing forum, the HDA, the Health Development Army Forum. And so there is already a forum where community leaders and community itself and health system come together, and this exchange of information and taking shared responsibility idea was just presented in that and applied in that forum. So that was easily done in this case. The advantage that we got is that everybody understood and realized that everyone has to take responsibility within their scope to improve the health of the community. So on one hand, the community could voice their concerns about the non-responsiveness of the health system, whereas the health staff could direct the attention to the community's role as well. So there was this exchange of openness in sharing the concerns about the other's role. And so there was good discussion, and at the end they had good decisions as well about who would do what and how they can do that. So at the end, the Kabila administrator, religious leaders, and the team leader, and all voluntarily took assignments, and they said that this is how, or this is what they will do, and they will organize themselves for implementation. And later on in next meeting, they will come and report on that one. So the basic message here is it's possible, it's there, it just needs to be done in a more systematic manner. And if it's done in that manner, there would be shared accountability, and there would be exchange of data across community and health system interface. So thank you very much for your patience and listening to this presentation. And I think we can open up for some question answers if there are any.
Yes, so we'll be waiting for your questions in the questions box. I think Dr. Binyam is online, but I can't find his name on the list. Dr. Binyam, can you hear us? Oh, I think he got disconnected again. Are there questions from our audience? Please feel free to type in your questions in the questions box. Dr. William.
Is Dr. Pedium on?
Typing, but I cannot find his name on the list, Doctor. We have one question here, Dr. Tariq.
Yeah.
It's from Dr. Christine. So she's asking, what were some challenges you encountered in your pilot in Gondar?
Mm-hmm. Well, thank you very much for your question. Well, I would say we didn't face much of a challenge. And the reason is obviously that we took advantage of the current situation. So like the University of Gondar had already good communication with this Kabyle leadership. And there was already this HDA forum, the Health Development Army Forum existing there. And it took only little convincing these leadership at the community level to kind of organize such meeting and have such a discussion. So in terms of organizing it, there was not much of a discussion. But as I said in my presentation, one challenge was that there was some finger pointing, or you have not done this and we are not getting service, things like that. But the observation that we had from the team, like the University of Gondar team, they found that this is an essential part of the teaming up, the forums dynamics. If you don't do that or don't let that to happen, then the things are kind of not vented out, and then the people will say, oh, this forum is not very useful because we cannot express ourselves. So initially there was this kind of a outburst, if you like, to some extent, but the Kabyle leader was able to kind of moderate the things and listen to everybody's concern, and so they started to look at it more in a more calm manner and say, all right, let's talk why this is not happening, why there is not good services provided at the health facility, for example, what's happening, what can be done. And as you can see, one of the member was from the district hospital, district health facility, so that person could keep a note of what are the concerns and talk to his supervisor or his team. So the challenge, the challenge could be if there is no such existing forum, then organizing the forum could be a challenge. But if there is, then it's better to use that opportunity and bank on it. Again, in terms of the internal dynamics within the forum, I think it should be left on the community and the health system to be more open and transparent. That would help in better communication and coming up with more or developing this mutual trust among each other. Thanks.
There's another question, Dr. Tariq, from Dr. Pramesh. Is there any influence of political parties in the project?
No, there was no influence of political parties. This is a forum, as you can see, that we went to the Kabyle administrator. So the Kabyle administrator is an elected person, and so we didn't want, or we did not kind of interfere with any existing processes. We are not promoting anything like that. Whatever is the current situation in a country, that's the reality, and that's where we are more concerned about health. And so there was nothing related to political parties or political issues. It was basically a health forum discussing about health. And anyone is invited, anyone can join. It's an open forum. So there is no kind of a selection that who should join and who cannot join. So there is no, as such, no political interference. But as I said, it's depend on how the country is organizing themselves. And we just we think that this forum should be based on the existing situation, not trying to change the whole political system of the country.
We have another question, Doctor, from Dr. Christine again. So, do you have any tips on ways to make the community take on the leadership role or make them participate?
So, do you have any
tips?
Oh, okay. Yeah. Well, I think again the tip is simple. You know, previously we used to think that communities do not have the leadership qualities. And that was maybe some 2-3 decades ago that we would think about that one. But even then, there was leadership within the community. But now it's kind of a norm that community has a leadership. Like there is a political leadership, there is a traditional leadership, there is religious leadership. So there are leaders within the community. And so it's not about trying to build someone, you select somebody and train them to become leaders and then put them in this forum and say, well, now you run it. The tip is to pick from the community, the kind of existing leaders who are there. They're already leading some activities or the community, especially if it's for health. And the tip or the secret would be to boost their qualities, to provide better leadership, in terms of managing a forum, in managing conflict, for example, between health system and the community, not kind of putting a lid on those issues or concerns, but how to have a more amicable environment where they can exchange their views and concerns and have open discussion. So it's more about promoting the existing leadership within the community. And if you want to bring in a external leadership, that is something that can be very detrimental to having a successful forum. So that's kind of a tip, is to focus or to allow the local leadership to take the ownership and lead the system, lead the forum, lead the discussion, lead this accountability intervention to have its root within the community. Thanks.
All right, we have another question, Doctor. This is from Dr. Sudeep. What about monitoring and evaluation program for its long-run effectiveness?
Yeah, that's part of the presentation where I presented 2 different tools. One is a qualitative, another one is quantitative. So that's where we are saying that this is something which they can use as for self-assessment, both of them. Or if someone is trying to promote, then you have those tools for monitoring and evaluation as well. So both tools are available. One is qualitative, where you look at simple things, whether there is a forum taking place or not. There is exchange of data or information, health information across both from the community and health system. and whether each of them are taking actions or not. And so you can put yourself in one of the boxes of those 4 boxes and see where you stand. The other one is quantitative, for the quantitative, and I just showed you the community part, but there is a health system part as well. And by the way, all of these can be accessed through this measure evaluation website. So if you go to that website and search for this community health data use for shared accountability, you will land on the page where you can download the guidance document and the presentation that can be used for orienting the community or the community leadership. And so for that, and this score tools is also there, so you can use that either for self-assessment by the community forum or by any other health system or any other facilitator, not, I won't say facilitator, but let's say catalyst, who want to also establish some kind of a monitoring of this of these forums. They can use those things. Thank you.
All right, thank you, Doctor. We have a message from Dr. Keith. He's saying, I hope that this pilot study be continued and monitored so it could be quantitatively measured, that the sense of accountability gained by the community from it indeed caused positive health outcomes for the community. An example, decreased maternal mortality or increased satisfaction on government health services.
Right, thank you for that encouragement. And what we would like to also say that this is not just a pilot for Ethiopia, it's for everyone in terms of measure evaluation. This is a global product, if you like. So it's available for any country, any organization to download and use it. And we would highly encourage you and kind of promote the use of this in any place, whether it's in Africa or Asia or Latin America, or and whether it's urban or rural, to download and use this guidance document to establish such forums, or if there are existing already, then use this guidance document to like monitor and make it more a formal forum so that you can achieve those successes that you just mentioned. Thank you for your advice again.
Are there any more questions from our participants? I guess there are no more questions, Dr. Tariq. So maybe we can wrap up the session.
Sure. Okay, then. Well, thank you very much who have attended and listened to this presentation. Thank you for your time and attention. And we are hoping, as I said, that you would be able to utilize this guidance documents in your settings as well. Thank you.
Thank you, Dr. Tariq and Dr. Binyam. Thank you, everyone. Goodbye.